Hi everyone, my name is Gregory. Today I would like to share with you the case I've been posting in the past at this forum, and I would like to share with you clinical tips how to approach this case and what was done at this patient. This patient is in the mid-30s, came to my office with chief complaint she didn't like her front teeth. She also stated that she went to different dentists, and when they put bondings, they didn't last for a long time. Now she decides, came to my office for her second opinion. It was probably the best solution for her. She also stated she has a financial problem. She can't afford doing anything expensive, as if it's everything is possible to do under the insurance company codes. So before I start this case, I have to find out why she has a problem in the first place and what can be done to deliver the final restoration is going to last you longer. Sometimes we see the forum dentist been asking what kind of material I'm going to use, if I'm going to use CEREC or anything else. To deliver the final restoration is going to be Impress, the Beta, Vita, the Emax, which one probably is stronger. But we're all missing the point. It's not the restoration type at this point, but why we had the problem in the first place. We always try to fix the findings, but we're not trying to fix the reason why the patient has it in the first place. So I approach this case from facially generated treatment plan. So I'll look at the pictures, I'll look at the position of her teeth, and I've been saying that her bite was a little bit lower than it should be, and by increasing her bite I can have enough space to restore her front teeth. But what's going to be involved? Most of her teeth are virgin, there is no cavities, and what's probably the best solution I can deliver to this case, so the patient would be happy and everyone in the office is going to be happy also. So in this case, I propose here as a treatment plan as a Deprogrammer. I use COIS Deprogrammer and a COIS principle. I have to deprogram the muscles to make sure that we find the right position of the patient's lower jaw. So in this case, what I've been doing is to place the composite between two front teeth, and I make sure that when the patient bites, they only bite only the one spot. You have to control it using blue and red articulating paper, and every time the patient bites, I want to see the small circle at that point, and those blue and red marks has to be coincide. And if the patient is repeating the same position and the same spot, it means he's deprogrammed. Okay, there is nothing other problems. Also, this composite block is showing me how much I can increase the patient's bite. Again, it's facially generated. You look at the patient's face, okay, or the position of the lower teeth, the upper teeth, the posterior teeth, what it's supposed to be. You can adjust this bite block, okay, lower it, or you can increase it. You can use a flowable composite, you can use any composite. So to increase and lower the bite, when you achieve the bite position, how much you will have to increase the bite. Okay, and again, the patient has to bite at the same spot. So make sure that when you're trying to deliver any kind of restoration, is going to be just fixed, unlaced, inlays, or crowns. It was the same repeatable position. It's very important, because if we're increasing the bite, we can't rely on maximum interconspation position. It means it doesn't work. So we have to have only central relation position is going to be only our reference point. So again, by putting the black composite block, I make sure the circle is very small, and this bite block or plane is perpendicular to the lower teeth. So when I achieve the result, okay, how much I have to increase the patient's bite, and I get the same small repeatable small spot here, I'm trying to put a composite filling on a buccal cusp or the first premolar. Either it's going to be a left side or the right side. You start with one side first. So you put in the buccal cuspal tip the composite material is going to be flowable, or any composite material is going to match the color of your teeth. So again, the patient bites. You're checking again with the blue and the red articulating paper. So make sure you have the same spot here and the same spot on the first bicuspid on buccal cusp. When you achieve the same result, the same circle, so then you go to another side and putting the same composite on another side. When you achieve the same result, when you have already 3 points, now you can remove easily this composite block, and the patient is going to bite on both sides. Do not do one side completely, like from premolars to the molars. Then you continue again. It's one tooth on a side at the same at a time. So that's how you increase the bite, and it's going to create the space for you. Have to increase the length and deliver the restoration for this patient. So once again, I'm going to repeat again. On some of the cases, you have to increase the bite. On some of the cases, you have to decrease the bite. So again, it's the facially generated treatment plan. You have your teeth related to the face. It's going to help you how to determine it's going to be decrease the bite, or we have to increase the bite. So in this case, we have to increase a little bit bite, like maybe like a millimeter. So now you can see this 90 degrees plane that I told you before. That's when the patient bites, they have to be 90 degrees, so there's no slope at this bite block. So the jaw will not that has an inclined position and distalize. So it has to be perpendicular 90 degrees. Now you can see the final result. The patient is 2 years post-op. Let's see, we increase the bite, we deliver the restoration, and it looks very nice. There is a time when you have patient with the symptoms and they bite in the wrong way. They can be complaining that they can't chew hard and soft food, and you would like to probably to help the patients and deliver. Again, it's a final restoration, but make sure you are fixing the problem first. At that time, you will deliver a cozy program, but it's going to be like a removable face. So what the cozy program is? It's a removable device, originally a removable device, where it's occupied the palate. There is a metal bow that goes around your teeth through the second molar. That's how the patient looks like when you delivered the cozy programmer. So the patient is going to bite again only in the one spot. Is also the 90 degrees. So, and the space between posterior teeth, if you insert the removable device, has to be 1.5 to 2 millimeters. Here in this picture it's a little bit longer, bigger. Also, the back portion of the cozy programmer has to be a little bit thinner here, so it will not interfere with the tongue position. So again, when you achieve the same result on the blue paper and the red articulating paper on the same spot, the patient leaves your office and wear this cozy programmer for 24 hours, at least 7 days. Most time it's like 7 days. And it gives you diagnostic position of your lower jaw. Depends on what the jaw is going to move. Then you figure out, can you help the patient with the front teeth? If the jaw moves to the front, you know, so when you deliver it, when you deliver your crowns or laminates, you're going to have problems, and the patient is going to dislodge those restoration, or going to break them, or going to break the teeth. So before again you deliver, you have to collect the data. So make sure you're helping the patient, but not making it worse. So what when the patient come back, again, there's a lot of information you have to know about the cozy program and occlusion. So when the patient come back to you, and you want to make sure that's where the jaw moves. On the next slide, you will see that's what we do. If the patient bites again in the same spot, it's a repeatable spot at the front, right here. Okay, and then you put the bite registration material. The patient bites with the program in, and then you send to your lab technician, or you can probably put the models together on your articulator, and that's going to give you a original position where the lower jaw is supposed to be. So they're also giving you the idea, if you deliver the final restoration, what's going to happen. And your technician will know the position of the jaw, okay, knows how to do your wax up and the final restorations. On the next video, you will see how I adjust or equilibrate the patient's bite with the Composite Deprogrammer in place. So this video you've been seeing that I've been using Deprogrammer when I add something to the teeth and increase the bite. On the second video you will see when I decrease the bite, what the steps I've been using. So I hope this video will help someone. If you have any questions, please post on the forum, and I'm glad to answer those questions. Thank you very much.